Thank you, ma'am. Hello everyone, this is Dr. Mitali Gulati, and today we are going to discuss NEET MDS 22 previous year question paper. So let's get into it. The first question says that abduction of the vocal cord during respiration, which intrinsic muscle is involved? The first option is the lateral cricoarytenoid, thyroarytenoid, posterior cricoarytenoid, and vocalis. Now, uh, to know that we should know the two terms before. We should know what is abduction and what is adduction. Abduction is whenever any part of a body moves away from the midline, whereas adduction is any part of the body moves towards the midline. Okay, further, let's have a quick review on the larynx, their supply, what are the muscles involved, and more. First, the sensory supply. Okay, let me zoom in. Wait a second. Wait a second, let me open the chat so that I can see all the chats. How can I see the YouTube chats live? Okay. Okay, continuing that, let us note the sensory supply of larynx. Sensory supply of larynx, the mucosa above the vocal cords is supplied by the internal laryngeal nerve. The mucosa below the vocal cord is supplied by the recurrent laryngeal nerve. Okay, this was about sensory supply. Now the motor supply. The motor supply, all the muscles of the larynx are supplied by the recurrent laryngeal nerve except the cricothyroid muscle, which is supplied by the external branch of the superior laryngeal nerve. Let us see. This is your superior laryngeal nerve. You can see, you can appreciate from here. This. Is this visible? Let me zoom in more. Right? Now can you see? Yeah. So, the superior laryngeal nerve, let us quickly go through the nerves of the larynx. This is the superior laryngeal nerve. Then this is your internal laryngeal nerve. Then the external laryngeal nerve. Right? This is your cricothyroid muscle. And this is the recurrent laryngeal nerve. Now, again viewing this, all the muscle of the larynx are supplied by recurrent laryngeal nerve except cricothyroid muscle. Except cricothyroid muscle, which is supplied by the external laryngeal nerve. Okay. Now, let us see the muscle of larynx. First, we will go through the names so that we once know all the muscle of the larynx. The first is the cricothyroid muscle. Second is the posterior cricothyroid muscle. Third is the lateral cricothyroid muscle. Fourth is the transverse arytenoid, oblique arytenoid, epiglotticus, thyroarytenoid, and thyroepiglotticus, and last is the vocalis. Now we'll view all the muscle one by one in the diagram. Firstly, we will see this diagram. Okay. See, this is the cricothyroid muscle above the cricoid cartilage. This is the posterior border of the lamina of the thyroid cartilage. This is the lamina of the thyroid cartilage. Okay. More you should know. Okay. Next, we'll go to the next diagram. We'll see the superior view of the larynx from this diagram. Right? Here we can see this is the vocal ligament. This is the vocal ligament. Here with the green I have highlighted. Now with the red I am highlighting the vocalis. The vocalis. This. You can see the vocalis. Now in the blue I am going to highlight thyroarytenoid. This is the thyroarytenoid. Okay. Now in the yellow I am going to highlight the lateral cricoarytenoid. And now in the purple we are going to see this is the posterior cricoarytenoid. Got it? Now in the black I am highlighting the transverse arytenoid. Now we have seen all the muscles once in the diagram also. Now let us see the movement of the vocal cord. Abduction of the vocal cord is done by posterior cricoarytenoid. Okay. Adduction is through the transverse arytenoid and the lateral cricoarytenoid. Tensor, that is making the vocal cord elongated, is done by the cricothyroid. Relaxer, that is making the vocal cord shorter, in the relaxing position, is done by the vocalis and the thyroarytenoid muscle. Okay. Okay. Now let's apply all these knowledge into the question. The question was abduction of the vocal cord during respiration. Which intrinsic muscle is involved? Now we know that abduction of the vocal cord is through posterior cricoarytenoid. Therefore, the answer goes the posterior cricoarytenoid. That is, let me highlight that, the posterior cricoarytenoid. Okay. Now, there was a question which was asked. I have also included in this question paper also, where they have asked, what if this recurrent laryngeal nerve got injured? So, as it is related to this theory also, I have included that in this slide, that if the injury of the internal laryngeal nerve happens, then anesthesia of the larynx happen. Injury to the external laryngeal nerve leads to cricothyroid get affected, because of which there is weakness of phonation. Weakness of phonation means there is difficulty in phonation. Now, in the external laryngeal nerve palsy happen. If it happens unilaterally, then there will be a loss of timbre of voice. If happen bilaterally, then effect of a voice is greater with reduced loudness and pitch voice is weak and hoarse. If the injury of the recurrent laryngeal nerve happen unilaterally, hoarseness of the voice happen. Is it visible? Let me zoom. Okay. If injury to the recurrent laryngeal nerve happens unilaterally, hoarseness of the voice is seen mainly in the patients. Also, respiration is not affected here. If it happens bilaterally, then loss of phonation happens, that is difficulty in the phonation. Also, difficulty in the respiration happens. Patient feels choking effect. Okay. Now, let us come to the next question now. Not a branch of the third part of the maxillary artery. Please read the question very carefully. Such terms, that is not, except, these terms make big difference in the question, right? So be careful while these terms. So here the question is saying not a branch of third part of the maxillary artery. So we should know what are the parts of the maxillary artery. So I have made a mnemonic to make it easy to learn. So maxillary artery is divided into three parts. The first part we have concluded in as a mnemonic as DAMAI. D-A-M-A-I. The D stands for deep auricular artery. A stands for accessory meningeal artery. M stands for middle meningeal artery. A is the anterior lymphatic artery and I is the inferior alveolar artery. Right? This is the first part. The second part is DPMB. So it is D is the deep temporal artery, P is the pterygoid artery, M is the masseteric artery, B is the buccal artery. The third part is three pigs. Three pigs is the posterior superior alveolar artery, pharyngeal artery, infraorbital artery, greater and lesser palatine both artery, sphenopalatine artery. So repeat after me, the my DPMB three pigs. Okay. Now एक बार डायग्राम से भी देख लेते हैं. Okay. The first part is this. The middle meningeal, anterior tympanic, deep auricular, superficial temporal. Oh, not superficial temporal leads to, sorry, the middle, wait, okay. The middle meningeal that I have marked, anterior tympanic, I have also marked that. Then deep auricular, right? Then we have left with your this accessory meningeal, and the last is the inferior alveolar. Okay, all these are the part of first part of the maxillary artery. The second part is the deep temporal artery, then the pterygoid artery, which is not shown here, then the masseteric, again not shown here, buccal artery. Okay, the third part is the infraorbital, posterior posterior superior alveolar, sphenopalatine, greater and lesser palatine both, then pharyngeal artery. Now the question was asking which is not a branch of third part of the artery now. So it is supraorbital. Sphenopalatine is a part, infraorbital sphenopalatine is a part, in lesser palatine is the part, then infraorbital is the part, but supraorbital is not a part. Again, not true about trigeminal nerve. Ganglions at the apex of the petrous temporal supplies the muscle of mastication, supplies all the maxillary teeth, origin from pons and medulla. This is true. Supplies the muscle of mastication, very true. Then supplies all the maxillary teeth, very true. Let's see on the fourth option. See, what is the position of the trigeminal ganglion? The ganglion actually lies on the trigeminal impression on the anterior surface of the petrous temporal bone near the apex. It occupies a special space in the dura mater called the trigeminal or Meckel's cave. There is two layers of dura mater below the ganglion. The cave is lined by the pia, is that okay? The lining is not important here. We should know that it is here. What we should know here is that the ganglion of the trigeminal neuron is purely in the pons part. Medulla part is not involved. It is not involved. It is completely in the, let me change the color. It is completely present in the pons part. We can see this is the motor nucleus of the trigeminal neuron. Okay, this is the sensory nuclei of the trigeminal nerve, and from here the sensory root is passing, and short a short motor neuron is going through it, right? Now again we'll see the options. The fourth option says that origin is between the pons and medulla. No, it is purely in the pons, not medulla. So the answer is fourth. Because this is not true. Okay. Next question. A young swimmer had an external ear infection. He went for a checkup. During otoscopic examination, he had cough. Due to irritation, which of the following muscle is involved? I'll again repeat the question. A young swimmer had an external ear infection. He went for a checkup. During otoscopic examination, he had cough. Due to irritation of which muscle? A. Vagus nerve, accessory nerve, facial nerve, trigeminal nerve. Okay. An ear infection can be potentially be linked to the cough through the vagus nerve, specifically via the Arnold nerve reflex. This reflex involves stimulation of the external auditory canal innervated by the auricular branch of the vagus nerve, triggering a cough. Therefore, when in the infected ear, when the examiner did the otoscopic examination, the patient cough when vagus nerve get irritated. So the answer goes vagus nerve. Clear? Moving further. Upper lobe of the right kidney is related to which rib? And for that, we should know the position of a rib and kidneys. So for that, I have attached a diagram here. Which says, okay, can you appreciate the left kidney touching the 11th rib also? I'm highlighting, hope I'll change the color. Can you appreciate the kidney outline? It is touching the 11th rib also. That is, the left kidney is little bit above as compared to the right kidney. And we see the right kidney, it is just involving the 12th rib. At the level of 12th rib. So, back to the question. Upper lobe of the right kidney is related to which rib? So, the answer clearly here is 12th rib. Right? Okay, moving further. Coffin corner is a posterior fascial pillar. Second is the retromolar trigon, tonsillar fossa or pharyngeal pouch. Now, let us see this diagram here. The retromolar trigon is a small triangular, let me mark for you. It is a small triangular. It's a small triangular area in the oral cavity, specifically behind the last mandibular molar. Right? This part. Behind this is your mandibular molar, and behind that we have a triangular area. Its base is pointing backward towards the maxillary tuberosity, and the retromolar trigon is subside of oral cavity covered by the mucosa. At, why we have named this different name we have given the retromolar trigon? Because most of the oral cancer is developed from this area, therefore it makes it important. Therefore we have named it, given a different name, that is retromolar trigon. Back to the question. Coffin corner is the we call this retromolar trigon as coffin corner. Okay. Next, Ansa cervicalis supplies thyrohyoid, stylohyoid, scalenus anterior, scalenus medius. To know, we should see the supply of the ansa cervicalis. Ansa cervicalis is actually a loop-shaped nerve in the neck formed by C1 and C1, C2, C3 spinal nerves. It innervates the infrahyoid muscle. Infrahyoid muscle, that is your sternohyoid, sternothyroid, inferior belly of omohyoid, and plays a crucial role in swallowing and speech. Now, this is your C1, wait a second, this is your C1, this is C2 and C3. If we see the diagram, C1, from C1, this nerve is coming and it's supplying the genohyoid and thyrohyoid. Let me zoom the diagram. From C2, let me change color. From C2, then C3 is also combining with C2 and then supplying the inferior belly of omohyoid, supplying the sternohyoid, supplying the sternothyroid, and supplying the superior belly of omohyoid, and then going again back and joining C1. Here a loop, you can see a loop is created. Therefore, the ansa cervicalis is a loop-shaped nerve in the neck formed by C1 to C3 spinal nerves. Let us also view from this view. Let me zoom. diagram, it is not more clear. Okay, here, can you see, this loop here? Can you see the loop here? I've marked with the blue. The position of the loop is at this level of the neck. Okay, going back to the question. Ansa cervicalis supplies stylohyoid. Yes. No, it is not. It doesn't supply the stylohyoid. There is no stylohyoid here. We have thyrohyoid here. So the answer goes thyrohyoid. Clear? Okay, moving further. Tongue muscles are derived from the muscle of the tongue. Both the intrinsic and the extrinsic are primarily derived from the myoblast that originate in the occipital somitis or the occipital myotomes, we say. The hypoglossal nerve innervates most tongue muscles, reflecting their origin from the occipital somitis. The exception of is the palatoglossal muscle, which is derived from the fourth pharyngeal arch and is innervated by the vagus nerve. All the muscles of the tongue is supplied by the hypoglossal nerve except your palatoglossus, which is supplied by the vagus nerve. Let us see. Let us see in the diagram. This is your okay. Intrinsic muscle के पहले बात करते हैं. Intrinsic muscle में first is the superior longitudinal muscle. These are your superior longitudinal muscle. Then your inferior longitudinal muscle, charger. Okay, then your transverse muscle. These are your inferior longitudinal muscles. These are your transverse muscles. Okay, now the vertical muscles. The vertical muscles are going like these. These are your vertical muscle. Same here. Correct. These all are your intrinsic muscle. Now extrinsic muscle. Extrinsic muscle, let me change the color. Extrinsic muscle. This is your extrinsic muscle. The genioglossus. Right? Then hyoglossus. These are your hyoglossus muscle. Let's take new color now. These are your styloglossus. Right? And we are left with have marked all the muscles, right? Now going back to the question is asking tongue muscle is derived from, now we can clearly answer, it is derived from the occipital myotomes. We have also seen all the intrinsic and the extrinsic muscle of tongue, we have seen its derivative. Clear? Next. Cilium dehiscence is present in laryngopharynx, nasopharynx, oropharynx or larynx. Cilium dehiscence in the posterior wall of the pharynx, the lower part of the thyropharyngeus. This is your thyropharyngeus. This is your thyropharyngeus. So it's saying lower part of the thyropharyngeus is a single sheet of a muscle, not overlapped internally by the superior and the middle constrictor. This weak part lies below the level of the vocal cords or the upper border of the cricoid lamina and is limited inferiorly by the thick cricopharyngeal sphincter. This area is known as Caliens dehiscens. This marked area in the diagram. This marked diagram is your Calien dehiscens. Pharyngeal diverticulum is formed by outpouching of this Calien dehiscens. Now, similar question is asked, is that the pharyngeal pouch is an extension of tonsillar fossa, Calien dehiscens, Calien diverticulum or oropharynx. So it is a outpouching of Calien dehiscens. We have seen in the above theory, right? Also we have seen that Calien dehiscens is present in laryngopharynx. Correct? Let us view one more diagram here. Can you appreciate this outpouching? This is called the Zenker diverticulum. And this is your Calien dehiscens, this small part. Calien dehiscens is more clear in this diagram, the above diagram. Now, if we have to see the outpouching, that is your Zenker's diverticulum, this diagram is good. Okay, next question. Space between the retropharyngeal space and the vertebral space is known as visceral space, prevertebral space, pretracheal space or danger space. This is very common question that I have asked many times previously. Danger space. Okay, before going, let us see the prevertebral, the retropharyngeal space and the prevertebral space. See, this is your prevertebral fascia, right? So this is the prevertebral space and this is the retropharyngeal pharyngeal space. And the fascia which is dividing these spaces, which is present in between these spaces, is called as alar fascia. This. Can you appreciate it? This is your alar fascia. Now, the danger space is a potential space in the posterior neck, extending from the skull base to the diaphragm, that is bounded by the alar fascia anteriorly and prevertebral fascia posteriorly. It is called danger space. Danger space क्यों बोलते हैं? Because infection or the tumor in this area can easily spread to the chest and abdomen and potentially lead to life-threatening complication. कोई भी infection होगा, कुछ भी tumor होगा, it is very easily can transfer from this space. That's why we call it as danger space. Next question. Okay, let me mark the answer. Now clearly we know that it is a danger space. Clear? Next. Unilateral paralysis of recurrent laryngeal nerve. I have explained this before. Unilateral paralysis of the recurrent laryngeal nerve leads to, clearly we have already seen that is hoarseness of voice. Unilateral. If it would be bilateral, then respiratory is also involved. In unilateral, respiratory system is not involved. तो स्ट्राइडर तो होगा नहीं. Next. Which is not a respiratory neuron? Dorsal respiratory neuron, ventral respiratory neuron, pneumotactic center, caudal ventral lateral medulla. And to know what is the respiratory neuron, we should know this. See, regulation of the respiratory system is be nervous or chemical. So, nervous में we have medullary center and pontine center. Sorry, pardon me for a second, please. This is not charging. on this now. Okay, the regulation of the respiratory can be through nervous or the chemical center. Nervous center is further divided into the medullary center and the pontine center. Medullary center, we have the distal root ganglion and a ventral root ganglion. डिस्टल रूट गैंग्लियन का काम होता है रिदमिक रेस्पिरेटरी डिस्चार्ज करवाना और वेंट्रल रूट गैंग्लियन का काम होता है फोर्सफुल एक्सपिरेशन करवाना. पोंटाइन सेंटर में वी हैव न्यूमोटैक्सिक सेंटर एंड एप्यूस्टिक सेंटर. न्यूमोटैक्सिक सेंटर्स हॉल्स इंस्पिरेटरी डेप्थ फाइन ट्यूनिंग करता है. स्विच बिटवीन इंस्पिरेशन एंड एक्सपिरेशन के बीच में स्विच होता है, वो किसकी रिस्पॉन्सिबिलिटी होती है? न्यूमोटैक्सिक सेंटर. देन एप्यूस्टिक सेंटर क्या करवाता है? एक्साइट डोर्सल रूट गैंग्लियन टू इंक्रीज द ड्यूरेशन ऑफ इंस्पिरेशन. ये एप्यूस्टिक सेंटर का काम होता है. केमिकल में हमारे पास होता है सेंट्रल एंड द पेरिफेरल सेंटर्स. नाउ द क्वेश्चन वाज व्हिच इज नॉट अगेन नॉट अ रेस्पिरेटरी न्यूरॉन. Dorsal respiratory center is a part, ventral is a part, pneumothoracic is a part, caudal, ventral, lateral medulla is not. Okay, so the answer is fourth, the caudal, ventral, lateral medulla. Next, renal tubule function is best assessed by. See, renal tubular function is best assessed by using a combination of urine analysis, measuring of urine osmolality and specific gravity, and potentially specialized tests like water deprivation test. Urine analysis help to detect abnormalities like presence of glucose or protein, while urine osmolality and specific gravity assess the kidney's concentrating ability. Kidney कितना कॉन्सेंट्रेट कर रही है यूरिन को, वो हम स्पेसिफिक ग्रेविटी से पता करते हैं. सो द आंसर इज 4, अर्ली मॉर्निंग स्पेसिफिक ग्रेविटी. बेस्ट फंक्शन हमें इसी से पता चलता है. नेक्स्ट, नी जर्क रिफ्लेक्स इज एन एग्जांपल ऑफ. नी जर्क इज अ डीप टेंडन रिफ्लेक्स या फिर इसे बोलो मायोटैक्टिक रिफ्लेक्स है. इट इज अ मोनोसाइनेप्टिक रिफ्लेक्स. ओनली वन pathway of the nervous system is involved. That's why it is monosynaptic reflex. Then एक होता है withdrawal reflex. It is a polysynaptic reflex. It involves many pathway of the nervous system in response to the noxious stimuli, जैसे burns में होता है. Then spasticity occurs in the upper motor neuron lesion. Question देखें. Knee jerk reflex is an example of. So it is a deep tendon reflex. Clear? चलो next. Brodmann areas 4 is represents what? So इसके लिए we should know certain areas और उनके नाम. Area 1, 2, 3 is the post central gyrus. सारे नहीं पढ़ने इसमें, जो मेनली पूछे जाते हैं अपन उस पर कॉन्सेंट्रेट करेंगे. ओके, सो एरिया 1, 2, 3 is the post central gyrus. Area 4 is the pre-central gyrus. You should know the area 22, which is the primary auditory cortex, also known as Wernicke's area. Right? So the question, Brodmann's area 4 was your pre-central gyrus. Pre-central gyrus. Option A. Next, which glial cells act as binding factor in the retina? Amacrine cells, Mueller cells, ganglionic cells, horizontal cells. For answering this question, we should know all the cells. Mueller cells are the major type of the glial cells in the retina that are responsible for the homeostatic and the metabolic support of the retinal neurons. Let's locate the Mueller cells. Can you see the Mueller cells? The green, sorry, my pencil is not working. Could you see that the green and pink is the Mueller cells? Then amacrine, the light green one is your amacrine cells. Then horizontal cells, the sky blue one is the horizontal cells, right? Ganglionic cells, the yellow marked one is your ganglionic cells. If you see that only the ganglionic cell is present in the ganglion cell layer and the rest is present in the inner plexiform layer, right? So let us see the amacrine cells. Amacrine cells transmit signal from rod bipolar cells to the ganglionic cells. Ganglionic cell is a multipolar cells that provide connection from the bipolar neuron and amacrine cells to the neuron in the CNS. So again we will locate these cells, the Mueller cells, the green one, then your horizontal bipolar cells, the red one connecting amacrine cells transmitting the signals from the rod bipolar cells to the ganglionic cells, right? Then ganglionic cells in the black and the yellow. So the answer, which glial cells can act as binding factor in the retina, that is Mueller cells. Mueller cells act as a binding. Can you see the extent of the Mueller cells from the retinal nerve fiber layer to the outer nuclear layer? So it binds, it acts as a binding factor in the retina. So the answer goes Mueller cells. Propionyl coenzyme A is produced by the metabolism. So we should here note the metabolism of lipids. Propionyl coenzyme A is a 3-carbon molecule produced during beta oxidation, which includes 3 steps. First is the oxidation odd chain fatty acids. Odd chain fatty acids से हो सकता है certain amino acid जैसे valine, isoleucine, all this threonine से हो सकता है, and cholesterol side chain से हो सकता है. Beta oxidation of fatty acids involves 3 stages. Activation of fatty acids occur in a cytosol, then transport of these fatty acids into the mitochondria. Mitochondria में beta oxidation proper होता है, ठीक है? पहला स्टेज देखते हैं फैटी एसिड एक्टिवेट कैसे हो रही है. सो फैटी एसिड गेट एक्टिवेटेड टू एसाइल कोएंजाइम ए बाय थियोकाइनेज और एसिटाइल कोएंजाइम सिंथेटेज एंजाइम. कौन सा एंजाइम इन्वॉल्व हो रहा है? थियोकाइनेज. ये साइट दिया है एक चार्ट. फैटी एसिड थियोकाइनेज के प्रेजेंट में एक एटीपी यूज भी हो रहा है यहाँ पे. देन acyl adenylate फॉर्म हो रहा है. देन acyl coenzyme is formed. This was the fatty acid activation. अब fatty acid activate हो गया. अब now the inner mitochondrial membrane is impermeable to these fatty acids. अब पर अंदर कैसे जाएगा फिर? We need to change into something जो इस membrane को क्रॉस कर ले, बिकॉज फैटी एसिड तो नहीं कर पाएंगे. अ स्पेशलाइज्ड कार्टिनिन कैरियर सिस्टम होता है, जिसे कार्टिनिन शटल भी बोलते हैं. जो ऑपरेट करता है ट्रांसपोर्ट एक्टिवेटेड फैटी एसिड का साइटोसोल से माइटोकॉन्ड्रिया में, और ये 4 स्टेप्स में होता है. ओके, नाउ लेट्स सी दिस chart. First is your cytosol, then middle is your inner mitochondrial membrane, and then we have the mitochondrial matrix. Acetyl coenzyme A, in the presence of catenin acyl transferase 1, is converted into catenin. Now this catenin can be transferred to the membrane, and for that we need some carrier protein. Catenin, as soon as goes into the mitochondria, again it converts into the acyl coenzyme A in the presence of catenin acyl transferase 2 this time. Clear? Now the third was the beta oxidation. Each cycle in the, sorry, it's not E, it's beta. The beta oxidation proper. Each cycle of the beta oxidation liberating a 2-carbon unit acyl coenzyme A, occurring in a sequence of 4 reactions. So this is the whole फैटी एसिड से असाइल कोएंजाइम ए बना साइटोसोल में, देन वो क्रॉस किया मेम्ब्रेन को, देन माइटोकॉन्ड्रिया में आया, असाइल कोएंजाइम से पूरी प्रोसेस हुई. पूरी प्रोसेस होने के बाद असाइल को एंजाइम ए 2 पार्ट्स में बना, एक जो ऑड चेन है, एक जो इवन चेन है. जो इवन चेन है वो तो क्रेब्स साइकिल में चला गया, और जो ऑड चेन है वो दोबारा रिसाइकिल हो गया. Got it? Now we see the propenyl coenzyme A. Propenyl coenzyme A is converted into propenyl coenzyme A carboxylase के presence में D-methyl malonyl coenzyme A. Then D-methyl is converted into L form. D से L form में convert होगा. Then for this we need vitamin B12. Vitamin B12 का इसमें बहुत important role होता है to convert L-methyl malonyl coenzyme A to methyl malonic acid. Then which is converted into L is then converted into succinyl coenzyme A. Then this succinyl coenzyme A goes into the TCA cycle. Correct? The question was, propenyl coenzyme is produced by the metabolism of odd chain fatty acid. अब तो ये बहुत simple हो गया because we have gone through very deep discussion on this. So odd chain fatty acids. A. Next question. Which opioid has no additional anticholinergic action? Methadone is an analgesic and has relatively less anticholinergic action. Others include codeine, fentanyl, morphine. So